Have you ever wondered how a single unit of donated blood can save multiple lives? Today we explore blood components and why they matter in modern medicine. Historically, many patients received whole blood. Advances in blood banking now allow safe separation into components tailored to patient needs, improving outcomes and conserving resources. Separating blood means treating each clinical problem precisely. Red cells for oxygen delivery, plasma for clotting factors, platelets for bleeding, and more specialized products from Hemapheresis. In this session, we will cover how components are prepared, visual steps of separation, common clinical uses, indications, and a brief look at hemapheresis. Our visuals use clear 3D animations, step-by-step labels, and uncluttered overlays to maintain focus on key clinical concepts and practical transfusion decisions. Keep subtitles on for clarity and to follow clinical terms. Before that, please subscribe to this channel for regular conceptual paramedical videos. Let's begin with the basic components and how a single unit becomes multiple life-saving products. A unit of whole blood is first collected into a sterile, anticoagulated bag and labeled for traceability and safety before processing in the blood bank. Next, the unit undergoes centrifugation. Controlled spinning separates components by density, layering red cells at the bottom, a buffy coat, and plasma on top. After separation, technicians express plasma into a satellite bag and red cells into another bag. The buffy coat containing platelets and white cells may be processed separately. For platelet concentrates, pooled buffy coats or platelet-rich plasma is further processed and may be stored with gentle agitation at room temperature. Plasma can be frozen as fresh frozen plasma to preserve clotting factors, labeled with collection and freeze times before storage at recommended temperatures. Each step follows strict quality controls and documentation to ensure compatibility and safety for transfusion. Traceability remains critical throughout the process. Packed red blood cells are prepared by removing most plasma. They increase oxygen carrying capacity and are the primary treatment for symptomatic anemia and acute blood loss. Indications include symptomatic anemia, significant hemorrhage, and perioperative blood loss. Transfusion thresholds vary by patient condition and institutional protocols. Red cells are typically stored refrigerated, with expiration depending on anticoagulant and additive solution used. Compatibility testing reduces risk of hemolytic reactions. Leukoreduction and irradiation are additional processing steps used for certain patients to reduce febrile reactions or prevent transfusion-associated graft versus host disease. Specialty red cell products include washed cells for allergic reactions and CMV-negative units for high-risk neonates or immunocompromised patients. Monitoring during transfusion focuses on vital signs and early recognition of reactions. Documentation of volume, time, and patient response is required after each transfusion. Plasma contains clotting factors, albumin, and other plasma proteins. Fresh frozen plasma is used to correct coagulation factor deficiencies in bleeding patients. Indications for plasma include massive transfusion protocols, factor deficiencies when specific concentrates are unavailable, and reversal of warfarin in urgent bleeding. Platelets are essential for primary hemostasis. Platelet concentrates prevent and treat bleeding in thrombocytopenic patients and those with platelet dysfunction. Typical indications include active bleeding with low platelet counts, prophylaxis for invasive procedures in severe thrombocytopenia, and certain chemotherapy patients. Platelets are stored at room temperature with agitation and have a shorter shelf life than red cells, increasing emphasis on timely use and inventory management. Cryoprecipitate is a concentrated source of fibrinogen and other factors and is used for hypofibrinogenemia or massive transfusion when fibrinogen is low. Hemapheresis is a procedure that collects specific components directly from a donor and returns the remainder. It yields high-quality platelets, plasma, or red cells efficiently. Hemapheresis enables single-donor platelet or plasma collections that reduce donor exposure for recipients and provide larger therapeutic doses when needed. Clinically, choose components based on specific deficits, oxygen needs for red cells, coagulation factors for plasma, platelet support for bleeding or procedures. Key safety principles include ABO compatibility, screening for transfusion-transmitted infections, monitoring for reactions, and recording product details in the medical record. Emerging practices focus on targeted component therapy, pathogen reduction technologies, and optimization of donor selection to enhance safety and supply sustainability. In summary, component therapy maximizes benefit from each donation, tailors treatment to patient needs, and represents the cornerstone of modern transfusion medicine.